pelvis starts to tilt, you can go and have them bend this knee a little bit, like so, and that should help some, right? So make sure your force is straight down, but even then, there is going to be some tilting, so you can minimize it by doing that. So that's all the test that we have done. Now moving on to the treatment. So we have a treatment to a manual technique to correct anteriorly rotated ilium and posteriorly rotated ilium. So I'm going to have Caleb turn to his right side, facing me. Have you scoot towards you, please? That's good. So I personally don't use these techniques, but they are in your Latin textbook, and therapists that are trained, you know, they have Maitland training, they do that. So I'm going to show it to you guys. Like, you probably should know it, whether you use it or not. That's, you can decide that later. So if the ilium is anteriorly rotated, then you want to posteriorly rotate it, right? Okay. And remember, I mentioned it the other day that if something is anteriorly rotated, they're going to have a problem getting into the posterior rotation type of activities. And so that's what we're going to do. So the first one is, so he's in a sideline position. This is how it is in the Latin textbook. I might have him come scoot towards me just a tiny bit more. Okay, that's good. And bend his knees. So I'm going to try to posteriorly rotate his ilium. Okay. So my hand position, this hand is over his iliac crest, more towards the ASIS. And this one is going to be over his ischial tuberosity. Are you fine? Okay. And you kind of get close to them, and then I kind of use my entire arm. I think it's easier than just the heel of my hand. And then I'm going to posteriorly rotate it. And you're doing it to correct potentially hypomobility, so you're going to be using grade 3s and 4s. So don't need to worry about 1s and 2s. So my hand, I don't know if you can tell my body position, but I'm pretty much over his hips, and so I can use my body. So I'm kind of like driving the wheel in this direction. Okay? So that would be if you want to gain posterior rotation or correct for anteriorly rotated ilium. Likewise, when you need to correct for posteriorly rotated ilium, now you're going to drive the wheel in the other direction. So my hand position, this one, my left hand position changes a little bit. The right one is still on the ischial tuberosity, and now instead of the left end, instead of being on closer to the ASIS, I have more posterior part of his iliac crest. And I'm going to rotate it like this. Got it? Like I said, you can decide if this is something you want to do it or not, but it's part of this, one of those techniques that is in the textbook, and we've been teaching it every year. So.